Gynecomastia. Okay, Gynecomastia, you can refer it to as manboobs. Technically, it's actually an enlargement of breast tissue. In a nutshell, medically speaking, it's due to excessive fat and gland tissue around your chest. Based on international data, 4 in 10 guys suffer from this condition. Among the teenager groups, 3 to 6 out of 10 will have this problem. Unfortunately, this isn't a problem that goes away with time. As we age, the incidence increases as well. 7 out of 10 people, when they reach the age of 70 years old and above, will have these issues. The most common complaint is when you feel your chest or your breast looks too feminine. You are too embarrassed to show it, you are afraid to take off your shirt, you are reluctant to participate in most activities. If you feel you have this problem, you might want to pop into your doctor to see how bad the case it is. Essentially, during the examination, I'll be looking at the amount of fat tissues, set gland sizes, and whether or not you have any loose skin. If you are diagnosed with gynecomastia, the best option is surgery. The enlarged glands can be removed through tiny incisions around your nipple. What happens during the surgery is enlarged breast glands can be removed through tiny incisions around your nipple and areola. And any accumulated fat cells can be removed through keyhole surgery with liposuction. The surgery takes 1 hour. After the surgery, there will be some swelling, but you should be able to get back to your normal activities within 2 to 3 days. The swelling should subside after 3 to 4 weeks, and you should be able to get back to your full range of activities after that. Over the course of 3 to 4 months, your skin will tighten, the tissue will firm up, and you will get the chest you want.
Now the acid test.
Let's check it out first, alright? Okay, I'm checking for glands. What I'm feeling is any firm, hard, glandular-sized tissues.
Okay.
In your case, you have slightly enlarged glands.
Okay.
Just measuring about 3 to 4 centimeters in diameter.
Okay.
Yeah.
Is that large? Is that
slightly enlarged?
okay?
Anything above 2 can be considered enlarged.
Okay.
Okay. Now, next I'm going to check on the amount and thickness of the fat tissues. This, for your case, this is where your fat tissues are.
Right.
So this
where it starts off from
starts
being hard,
here.
I guess.
Yeah, this is the gland, which is hard,
Okay.
and then this is the soft part of the fat tissues. Usually wraps around your breast tissues.
Right.
So for you, you do have this accumulation of fat tissues around your chest that needs to be reduced to have a firm, tight chest.
Okay.
Next, I'm going to check on the fat layers, fat tissues. This is the shape and size of your breast tissues.
Right. So
Yeah.
when it's hard here, there's
This is
no
your
fat.
muscle.
Right.
When it comes here, can you feel the fat layer starting from here
Okay.
all the way around here to here,
Right.
wrapping around your glands,
Right.
and you have to remove this
Right.
to get a firm, tight
So what
one of the
happens
chest.
is if you remove it, my chest is here. okay,
Yes,
flat
go lift it up.
Right.
Yeah, that's
Okay.
what it is. And
Okay.
it's done through a keyhole
Right.
here
Right.
to allow liposuction to be done.
Right. So basically, this stage of it is lipolar.
Yes.
In that sense. Well, the earlier part you're talking about was the gland.
Gland removal
Yeah.
surgery.
Okay.
And finally, to assess the skin. This allows us to plan post-surgically how do we tighten or improve your skin to get better results.
Okay.
Yeah.
So in a nutshell, sadly, it seems like I do have a little bit of a case of it as well. Of course, I'm going to still maintain a fairly strict diet, try to burn as much fat as I can, and also maybe spend more time doing the bench presses. For now though, it's back to shirts on for me.